Hi, I'm Dr Ahmed Aoude, so bonjour tout le monde. Je suis un chirurgien oncologue en orthopédie et ça, c'est mon collègue Dr Anthony Bozzo. Je vais lui laisser s'introduire en une seconde. Nous, on va présenter un projet qu'on est en train d'entreprendre à l'université McGill. Je voulais remercier Cedars Foundation, la Foundation McPeak-Sirois pour avoir fait cet événement possible. Aussi à Jamil pour toutes les belles présentations et tout son effort pour rendre ça aussi possible. Alors, without further ado, we'll present you the superstar here, Dr. Bozzo.
Thank you sincerely to Dr. Asale, the Cedars Cancer Foundation, McPeak-Sirois, everyone for this opportunity. Dr. Aoude and I, we both do everything we can to help patients affected with sarcoma, cancers of musculoskeletal tissues. And these are complex patients. And we've been working together for a while, and what we're going to show you is what we've started to develop that will try to help our patients, help them have a smoother journey through their care pathway, help decrease errors, and then on our side, help us with research and data sharing. So that's our vision, and we'll tell you a bit more about it.
So we can't present without leaving Joseph Petruccelli out of this picture. He's a bright master student that we met teaching an innovation course, and from there, this kind of project grew to become a reality. So our vision, we called it OncoTrack. We're oncology surgeons, and we want to follow these patients with a more simplified and optimized workflow for us in clinic, but also for our patients, for our nurses, and for our clerks. So we want to basically not disrupt the existing hospital infrastructure and implement this software to overlay on top of any software that's already being used to simplify the use. So think of your iPhone. The interface you use interacts with everything in the back end that's much more complicated, and that's what we came up with and actually created. So unlike any conventional medical records that require millions of dollars for investment, here we're talking about just an overlay and decreasing costs. The problem's very clear. We heard about it from everyone. We are overwhelmed with needs in the healthcare system. We don't have enough people, we don't have enough resources, so anything that we could do to amplify that is what we are looking for. Our system requires lots of tests. Patients are seen for too little amount of time. They're not educated enough. They're anxious. Our MDs are overworked. There's too much clerical work. Our clerks are disorganized. Our nursing is disorganized. So how could we do and what could we do to improve this? And this is where we all came up with this idea and we created it. So the list keeps going, and I won't take much of your time for that. But this is a video we asked AI, what can you do to decrease the burden? And this is the video that was given to us, okay? So you could see it really, when I show you what we've created, really mimics this. And here's another one, okay, where you see a virtual screen and basically ability to get data in a very fast fashion. So OncoTrack, what is it? It's a web-based solution. Everyone can access it from anywhere, from your phone, from your tablets, from anywhere. It is AI-driven, has AI algorithms within it to learn what I like to do. So I like to do things a little different than Dr. Bozzo. Try to influence him as much as I want. He's still going to do it the way he wants to do it. And this software gets to know my preferences and implements them for my patients immediately. It creates patient trajectories. It educates our patients. So whenever we put in a diagnosis, the patient is educated with literature that we choose, that we have vetted, that allows them to understand their disease better, understand the surgery that they're going to get better, and understand the postoperative care they're going to get better. It simplifies communication between me and my colleagues, me and my nurses, me and my clerks. No longer filling out papers that then go to the clerk up front who can't read my bad handwriting, who then come and talk to me or call me later on. So that's the whole idea behind the basis of this software. It improves data collection. We're able to get statistics on the fly, modify data as we want, use this data for government statistic tracking, for our own tracking, for our understanding of patient outcomes pre-op and post-op, for the acts that we're doing for these patients, and help the patient remember to come to their exams, give them stats about their exams, give them understanding about their own data. So no need to change the entire EMR like everyone's trying to do in Quebec. Why not use a tool that overlooks this, unifies or universalizes the use of this software without changing a single software component? So the key features, as I discussed, are AI-driven workflows. We also, hopefully will partner with the great Alex Squared, I call them, U Squared group here, to allow us to have 24/7 access for our patients to ask their questions, that then gives us the input, that then even modifies the trajectory as needed. We want customizable clinics that allows this not to only be useful for us in orthopedic oncology, but orthopedics, ER, cardiology, internal medicine, etc. So here's a screenshot of the actual software we've created. And another point to say is that we created this with the intelligent people that were in the group, but other students that are not mentioned that had a great part to do with this, but we were able to do within a year and a half something that I thought was impossible, harvesting AI to help us develop this software. And as you can see here is just a screenshot of this actual program that is already integrated with different trajectories, different profiles for clerks, nursing, doctors, etc. So, in short, it's OncoTrack is an inter-institutional collaboration, the way I want to describe it. It allows people to centralize their data. It allows people to talk the same language, and it allows people to gather the data that they need. So for now, we're at a pilot study at the sarcoma clinic that is underway. This is all HIPAA certified, confidentiality, and all the standards for patient confidentiality have been included. We have even talked to CAI, who's a federal agency, to standardize this data. So, possible collaborations. We already talked to Dr. Asala. U Squared is a great component to this that I see in the future. We've already talked a little bit, me and Alex, about it, but we'll push this further. This will help us get 24/7 support, help educate, etc. I hope I got the message across, and we're here to answer your questions, and we're more than happy to push this forward with anyone who wants to collaborate. This is the whole idea behind this, so thank you very much.